Hi there. Today we're doing a little something different. I'm going to do kind of a how-to video. So this will go along with the vital signs video. And I just want to first kind of just show you the various things we use to take vital signs. This is a blood pressure cuff. And as I had mentioned in the video prior, I just want to show you a few features. Here is the range marks that I was talking about in my other video. And then here is the index mark, okay? So when you wrap this around a person's arm, this edge needs to fall within this area here, this range area, or it is too big or too small. So if it's way out here, the cuff is too small for the arm. If it's way in here, the cuff is too large for the arm. And as I mentioned before, if it's too small, you're going to get an inaccurately high reading. And if it's too small, if it's too large, you're going to get an inaccurately low reading. So you don't want to do that. Secondly, this is the gauge that we read. Let me go ahead and bring that a little closer so you can see it. If you will notice at the bottom here, there is a little rectangle. Some of them have an oval. Otherwise, you'll see the rectangle there. And when the cuff is deflated completely, you want this needle to fall into that rectangle in this case, or oval, and that will indicate that it is calibrated. If it is outside of that area, it is not calibrated and therefore will not give you an accurate reading. So you'll need to calibrate it. Now, most of these type come with a little, it looks like a key or a little wrench. And all you do is just disconnect this tubing here and turn this, and it will push the needle back into calibration. What you use in the doctor's office or the clinic is usually a cuff that is connected to a gauge that's on the wall. And those will have their own special tool if they, should fall out of calibration. But this kind has a little tool for it. Okay. Secondly, the stethoscope. Okay. Stethoscopes are used when you're taking the blood pressure. And if you've ever noticed, the earpieces on a stethoscope turn one way or the other. They're not completely flat. There is a right and a wrong way to have these in your ears. So when you put your stethoscope in your ears, you want to make sure that the earpieces are facing towards your face. Okay, so not backwards like this, but forwards like this. Otherwise, you won't be able to hear anything. If they're backwards, the hole that's in the earpiece where the sound comes out of is actually going to be pushed up against the inside of your ear, and you won't be able to hear anything. If it's forwards, though, it'll be in the opening of your ear, and you'll be able to hear. The other thing to keep in mind is this guy here, the bell. These particular type, the one that have two sides like this, turn. Okay? When you put this in your ears, just give it a nice little rub here, and you should be able to hear that. If you can't hear that, it means it's turned the wrong way. Just turn it. Okay? Don't tap on these. If you tap on them, you can damage the diaphragm before it's time, basically. Excuse me. Plus, over the years, every day, 10, 20, 30, 40 times a day, that can actually damage your hearing. So make sure that you just give it a slight little rub. It'll be fine. Okay. Next, this is one type of thermometer that I have. This is a temporal thermometer. And I will show you how to use this shortly. This is your pulse oximeter. The pulse oximeter has a little on-off button right here, and I will also show you how to use that here in just a moment. Okay, so if I could get my patient real quick to come on over. This is my patient. Go ahead and step up here. You always want to help your patient up so they don't fall. Have a seat. Thank you so much. I just need to verify your name and date of birth, please.
My name is Penny Lane, and my birth date is October 1st, 2000.
Perfect. We always want to make sure we have the right patient. So we always want to get those two indicators, which is name and date of birth. All right, so first off, I am going to go ahead, and you always want to make sure that you clean the tip of your thermometer here before you use it. Have you ever had this done before?
I have not.
Okay, any of it?
No.
Oh, all right. I always ask my patients, even if it's something as silly as vital signs, I always ask if they've ever had it done before, because if they haven't, I want to make sure I give them a good explanation. Okay, so this is a thermometer. I'm just going to put this on your forehead and run it across, and we'll get your temperature. Okay. All right, so with this type of thermometer, you want to place it flat against the forehead first and then depress the button. Okay. And then you're going to hold that button down as you bring it all the way over into the hairline where the temporal artery is. Keeping the button pushed down, pick it up, put it behind the ear on an adult, and then you're going to go ahead and let go. As you can see here, I don't know if you can actually, 99.1 is what we got. This will always read slightly higher than an oral thermometer because it's more of a core temperature. And then we're going to go ahead and we're just going to clean that off again. All right, so next, we're going to go ahead and we're going to use the pulse oximeter. Some offices use these all the time, some don't, but I'm going to go ahead and demonstrate it. And I'm just going to need a finger from you, and go ahead and just relax that on your leg, and we'll just leave that there. Then I'm going to go ahead and I am going to check her pulse. Okay, now I am going to count, as I had mentioned in my previous video, if you're new at this, 30 seconds and then multiply it by 2, 15 multiplied by 4 if you're more of a veteran. And then I'm going to go ahead and I'm going to count for 15 seconds. Okay, and then I don't want her to know that I'm going to watch her breathe now. So I'm going to go ahead and keep a hold of her wrist here, and I am just going to watch her chest rise and fall. Now, because I said that, she knows now. A normal patient would not know this, but by holding her wrist, she still thinks I'm taking her pulse. And I am looking at my watch because I'm counting breaths again. If you're new at it, for 30 seconds, multiply it by 2. If you're a veteran, 15 seconds and multiply it by 4, okay? All right, and just like that, I have gotten her temperature, her pulse, and her respirations. The pulse I got on her was 78, and it said 75 on here, so very close. This also gave me a reading of 99 for her pulse ox, which is very, very good. All right, next and last, we're gonna go ahead and get the blood pressure. So I'll just need your arm here. You wanna make sure your patient's feet are not crossed. That can interfere with the accuracy. So if they are, just ask them to uncross their feet for you. I had mentioned in my other video too about the artery mark. This is the artery mark right here. We wanna make sure, because her brachial artery is right here, we want to make sure that that artery mark is right near that brachial artery, okay? And notice that I've put this roughly an inch or 2 above her in a cubital space so that I'm not sticking my stethoscope up underneath there, okay? All right, now I just need for you to just relax your arm for me. Some people have the patient hold their hips. Some will actually put it up under their arm. I don't like to do that, but if that's your jam, you do it. Okay, now that it is on there, I'm going to put my stethoscope in correctly. I'm going to take the head of my stethoscope that is currently off. There we go. And I'm going to place it right over that artery, because that is going to be the loudest place that we're going to hear. I'm then going to take my bulb here, and I am right-handed, so I tend to use this, my right hand, to do this. To close my valve, I'm going to roll this forward, okay? And then I'm going to go ahead and I'm going to pump this up to about 100 and see if I hear a heartbeat. I do hear a heartbeat, so I'm going to pump it again. I don't hear a heartbeat now, so I'm going to just very slowly release my valve, turning it back towards myself. I started to hear her heartbeat at 110, and it stopped at 68. So that is how we take a blood pressure. So basically what happened was I pumped it up to here and I could hear a heartbeat. So I knew her systolic pressure was going to be higher than 100. So I went ahead and pumped it up more. The reason I do that is so that I'm not over pumping and making it uncomfortable for my patient. I want to get just beyond that systolic pressure. So when I pumped it again, it went up to about 150. I didn't hear anything because that was beyond where the heartbeat was going to start. As it released, the first heartbeat I heard was at 110. And then it just kept going, beating, beating, beating. And at 68 is where it stopped. So her blood pressure is 110/68. Go ahead and take that off. Thank you so much.
Of course.
Okay. That concludes vital signs. And we would then go ahead and let our patient stay comfortable on the exam table or in the chair if they're more comfortable there. And we would go and let the provider know that he has a patient ready. Thank you so much. See you again next time.